Well, I'd like to welcome you back to our wonderful sessions. And before we start up the session, I too would like to thank the organizers for arranging this wonderful session on shale gas and public health. I'm Aaron Barchowsky. I'm a professor of environmental and occupational health at the University of Pittsburgh, just down the street. And what strikes me, and I was just saying this to John Stoltz, is we had one of the first sessions on this at least 15 years ago in School of Public Health. And I see some faces that were there at those early sessions on the health effects of shale gas, and many people saying that we should have more studies, et cetera, for the real health impacts of this. But for this sake, for this meeting, we have a wonderful session that I think is a great follow-up to the first session that we had today. In addition to my academic career, I've also spent about 20 years in advising National Academy of Sciences and EPA advisory panels on health effects and health regulations of industrial and environmental chemicals. And from that perspective, I can say that this is truly troubling times. It's not just troublesome, tempestuous, tumultuous, times. You could go into many different T's, but it is very concerning where we are in the regulatory environment for environmental health. And this isn't just because of the current attack on the ability to regulate industrial and environmental chemicals. It's also because there is a missing T in that alliteration. That T is transparency. And the lack of transparency for what is being used, what we are being exposed to, is certainly a major concern. This transparency is not specific to the shale gas industry. It's the way that our laws are written, the TSCA Act and other regulatory laws and regulations that are supposed to be protecting our health from exposures. Those laws have loopholes in them that essentially allow industry to be their own watchdog for what's healthy. There's all sorts of discussion of proprietary chemicals or proprietary formulations that don't have to be divulged, but probably should be. And our talks this morning really address the need for transparency and actually mechanisms to provide more of that transparency. It would be wonderful to help Dr. Nolan not just say exposure and exposure proximity, but actually say, what are you being exposed to? As a physician, yes, if we know this drug is bad, we won't use it, or if we know when it's going to be bad, we won't use as much of it. We don't know what many of the chemicals are that we're being exposed to. And as I say, this isn't specific just to the shale gas industry. So we have a wonderful session for you this morning, and it's being led by two great investigators who are working to decrease that toxic haze, increase transparency, increase accountability in our exposures. First up is Gary Allison, a prolific writer, but more importantly, he has worked quite a bit with frac focus data, organizing and analyzing millions of records and ensuring the integrity and accuracy of public data that's used by researchers and community activists. This is important because it's really putting rigor into our science. He serves as a technical consultant for Frac Tractor Alliance and has assisted on critical reports on PFAS chemicals, trade secrets, and the Colorado Disclosure Instrument for Physicians for Social Responsibility and Sierra Club. And so he's going to enlighten us on his methodologies.
Thank you, Aaron. I'm super excited to be here to finally meet some of the people that I've only talked to on Zoom for years. I really enjoyed those early talks. They were invigorating, and I'm looking forward to the whole program today. As Aaron said, my talk's going to focus on one critical aspect of understanding the health effects of fracking. That's the chemicals that are involved. Our understanding of fracking chemicals has long relied on Frac Focus, which is a national registry. Today I'll show you that this data set is significantly incomplete, and I'll use Colorado's new disclosure law to outline the scope of that missing information. A key thing to keep in mind throughout this talk is that the public's understanding and even many regulators' understanding of what chemicals are actually used in fracking is largely derived from Frac Focus. See if that works. There we go. Many fracking states require submission to Frac Focus. In Pennsylvania, for example, there are over 11,000 disclosures of distinct fracking events. And Frac Focus can tell us a lot about the presence and quantity of many of the chemicals used. For example, even though fracking is exempt from the Safe Drinking Water Act, we can still learn which regulated chemicals are being used and sometimes how much is being used. For example, one chemical regulated by the Safe Drinking Water Act is ethylene glycol. In Pennsylvania, 4.2 million pounds of the chemical were reported in 2024 fracking jobs. The largest use that year was by the operator Chesapeake in Bradford County, 230,000 pounds, and that's just in one well. This is the kind of data that we can pull from Frac Focus, and it's really helpful. Here is an example disclosure from just last December. This is a single well in Washington County operated by EQT. You probably can't read the small print here, but you may see that there's a lot of information, lists of chemical names, their ID numbers, their concentrations, the brand names of products, even the companies that supply them. It's a complex document filled with details and jargon. And in fact, when we approach these disclosures, we might have the impression that they are comprehensive lists. This slide represents a common starting point for many of us. I know it was for me, that if a chemical goes into the ground, it's going to appear on the list that there is a one-to-one relationship. That's not an unreasonable expectation, because in other high-risk industries, we don't allow mystery variables when public health is at stake. But I want to mention two reasons why that naive expectation is undermined. You probably know about the first reason, and Aaron mentioned it. Trade secrets are allowed in Frac Focus, and they are common. This, back at that same disclosure we saw before, we see that for this product, the chemical name of one of its ingredients is just a code, and the ID number is replaced by the words proprietary. In other words, it's a trade secret, and we can't tell what chemical it is. In Pennsylvania, 75% of disclosures contained masked chemicals as trade secrets. In total, we're talking about 200 million pounds of materials where we know a chemical was used because it's flagged in Frac Focus, but the industry has withheld its identity. The second reason why full disclosure is undermined is harder to notice, and it's more buried in the details, in the weeds. But a clue is in the fine print at the bottom of every disclosure. Ingredient information for chemicals is obtained from suppliers' safety data sheets. So, in other words, the operating companies use these safety data sheets as their ingredient lists. You may be familiar with these safety data sheets. They're the 5 to 25 page informational packets that can have lots of important public health information on the hazards of products. And there is a required table within these safety data sheets that lists chemical components of a product. Operating companies are using that component table for their Frac Focus disclosures. The problem is that these tables of components often don't include all the ingredients in the product. This is a typical example. It's a table from a product by Chemplex There are 3 chemicals listed, and the chemical identity is clearly marked, the CAS number there, but their contribution to the product is far less than 100%. Instead, the listed chemicals comprise somewhere between 32 and 46%. The other 50+% is not mentioned anywhere on the safety data sheet. Now, these safety data sheets are written by manufacturers of the products, and it's the manufacturers who determine which chemicals make it onto the safety data sheet. That is, which are the chemicals of concern. A chemical that gets left off the list might be just water or something else the manufacturer considers inert. Or it could be some chemical that has not been studied for its health impacts. And that's within these fracking chemical lists, at least that's very, very common. The point is, many ingredients go into the ground that will not make it onto the frac focus disclosures. They aren't just data gaps, they're unknown variables in public health research. Because frac focus has essentially been the only source of data about chemical uses, we run up against a wall when we try to get a picture of what might be in those gaps. But in 2022, Colorado passed a law that essentially broke through this wall. This law created a new disclosure instrument that's managed by the state's regulatory body, the Energy and Carbon Management Commission. I'm going to call it the ECMC. This new law explicitly set out to plug some of the known holes in frac focus so that the public could have a more complete picture of the chemicals used near their communities. At this point, it's important for me to acknowledge the extensive efforts of many people that helped pass this law. The Physicians for Social Responsibility, including both the Colorado chapter and the national office, and the Sierra Club were vital in that process. Their combined work was critical in exposing the extensive use of trade secrets in Colorado, which in turn motivated the need for a legislative change. Furthermore, both organizations put in the hard work to get the new law passed in the state. So the law tries to plug those holes in frac focus, first by mandating that chemical identities can no longer be masked as trade secrets. They're simply prohibited. Second, it shifted the reporting burden of those chemical lists to the manufacturers, the people who actually know the full ingredient list, rather than the operators. Colorado brought the manufacturers into the law. If they want their products to be used in the state, they must disclose the chemical ingredients first. The law also expanded reporting to include drilling and other phases, not just fracking. I'm not going to say much more about that issue here, but it's an important expansion to our understanding of the chemical landscape of a well pad. Two other things that are not on this table: the law forbids any PFAS chemicals, and it requires that operators directly share the list of chemicals with residents and schools and hospitals within a half a mile of the well pad. Now, these ECMC disclosures do not replace frac focus, but are reported in addition to frac focus. And that's actually a big opportunity for us because now we have kind of a natural experiment. For the first time, we have two independent records for the exact same well pad, the frac focus report and the ECMC report. We can now scrutinize frac focus using the ECMC data as the ground truth. We try to answer some questions. Given the greater transparency of the Colorado law, how much more is disclosed in the ECMC system than the frac focus system? And are any of these newly disclosed chemicals even important from a public health perspective? Now, before we try to answer those questions, I want to take a short detour to show a time series graph of how this new law rolled out, because it has some interesting lessons. The law went into effect in the summer of 2023, and new disclosures were to be made public by the end of that year. The climbing line here is the number of wells that were fracked under the timeline of the law. All of these should show up in the ECMC disclosure system. But implementation was very slow to start. The ECMC released the first disclosures more than 9 months late, and apparently only a few of the operators had disclosed to the system. By May 2025, nearly 2 years after the law took effect, compliance was dismal. Less than 40% of the required disclosures had been posted. Many operators appeared to be effectively ignoring the new transparency requirements. Before that time, PSR Colorado and the Sierra Club had tried to communicate with the ECMC to understand what the delay was, but there was little response. So those groups, along with Frac Tracker, prepared a report that documented these discrepancies. And with that, they calculated the estimated fines that these companies would owe by Colorado law if it was the operators who were actually at fault, and we couldn't tell at this point. Those estimates were in the millions of dollars for some of the bigger operators. And the Guardian picked up the story. Within days of the release of the report, that's the green line on that chart, disclosures started flooding in onto the ECMC website, and within a few months, disclosure rates were over 95%. And so only after public pressure and media scrutiny did we see this surge in filings. And it just reminds us that transparency isn't just a matter of law, it requires active external oversight to ensure compliance. Okay, on to the results of the comparison between FracFocus and ECMC. Let's start by just looking at the results from a single well pad by the operator Extraction Oil and Gas. It's on the outskirts of the Denver metro area and has 17 wells on it. The first thing that we note is that in the FracFocus data, there are 6 distinct trade secrets, and together they comprise over 750,000 pounds. Next, we look at the overlap where FracFocus and ECMC disclosures report the same materials. They overlap on 27 different chemicals, including 100,000 pounds of methanol and 500,000 pounds of hydrochloric acid. This set includes other typical things we see, such as ethylene glycol and cinnamaldehyde. But it's this last section that we're really interested in. Considering that there are 6 trade secrets in FracFocus, we might expect 6 chemicals on the ECMC only list that would represent those proprietary chemicals. What we find instead is that there are an additional 28 chemicals. Again, these are chemicals that went into the ground but are not on the FracFocus disclosures. These include some things with concerning hazard profiles like formaldehyde and ethylene oxide, which are both suspected carcinogens. So this is a comparison across just one well pad. Now let's look across a larger set, 160 pads. These are all pads where we could verify we were looking at identical wells and identical fracking events. I'm going to show these maps of Colorado to illustrate some of the patterns we find. The blue dots you see on the Colorado map are the well pads where the chemical ethylene oxide is reported to both FracFocus and ECMC. Ethylene oxide is a carcinogen with a number of other hazardous properties. But there are a handful of other pads, here marked in red, where the ethylene oxide is only on the ECMC data. The pattern is similar for acrylamide, another carcinogen. A large number of well pads reported in both FracFocus and the ECMC. But just as many other well pads report the chemical only in the ECMC system. And finally, for formaldehyde, it only shows up in the ECMC disclosures at all across these comparison wells. FracFocus never reports it. From a public health standpoint, a significant finding is that around 140 different chemicals were omitted from some FracFocus disclosures across these comparison pads. While some things like sucrose, cellulase, and guar gum aren't an issue. We found quite a few known hazards. These include the materials I've already mentioned, plus things like methanol, naphthalene, propargyl alcohol, and there are more known hazards. One thing that concerns me is that the hazards of a lot of these materials are largely unknown, as they have not been adequately studied. This didn't show up the way I thought it was going to show up. This is a summary of how much we know about those 140 different chemicals. It's a table of, it's an analysis based on the EPA's chemical assessment programs. At the top line, that's the chemicals that are thoroughly studied and recognized in formal programs. That's 8%. You can ignore those colored bars, they're out of place. Below that highest level of hazard assessment is provisional recognition. The third level is where some assessment has been done on chemicals, but they're not formally recognized. That's more than half. And then the line you can't see is the chemicals that have little or no assessment. That's about a third of the chemicals that are in that 140. The materials I've been talking about, formaldehyde, acrylamide, naphthalene, they're all in that group that's most thoroughly studied. But clearly among fracking chemicals, there are far more that are not well studied at all. And by the way, I'd love to talk to anyone who has ideas about how we can bring these unknown hazards into a picture of a chemical landscape, both for public health questions and for environmental impact questions. So these are the results we have so far for Colorado, and it's still evolving. This is still a new disclosure. What are the implications for other states? Well, two features of frac focus I mentioned earlier, trade secrets and safety data sheets, give us a clue. Both of those features are systematic and so occur at all states. Trade secrets are heavily used. Here, the orange part of the pie charts are the fraction of the state's disclosures that have trade secrets. So at least 3/4 of the disclosures have trade secrets in all of these states. And the use of abbreviated lists from safety data sheets is common. It can be hard to get access to safety data sheets in the fracking industry, but Halliburton makes all of theirs available. Across more than 5,000 of their products, 62% of safety data sheets report less than half of the composition of the product. Many of them way less than half. And of course, as you can imagine, Halliburton products are used throughout frac focus. So yes, very likely all states suffer from these frac focus holes. And hopefully the takeaway is clear that frac focus is not a complete record. If your state relies solely on it, you're likely missing a significant portion of the chemical profile. When the industry claims they're being transparent through frac focus, the Colorado data provide ample evidence to challenge that claim. And to recap all of this, frac focus is still an important source of information, as it's the only source of information we have in many places. But Colorado disclosures make it clear that there is significant underreporting. That is due, at least in part, to systematic problems with frac focus, and that exists in all states. These absences make it difficult to profile health hazards. Colorado's system may provide a good model for improving transparency in your state. And finally, I'd like to ask just for some help. We want to make this kind of chemical data more useful for community advocates and for public health professionals. How can we use this data to better support your work? How can we present data that helps communities better understand nearby hazards? How can we leverage what we're learning in Colorado to build a better understanding of chemicals in your state? And finally, I'd like to thank Frac Tracker Alliance for supporting the work on the OpenFF project. And thank you for your attention.
So we'll continue the theme with our second speaker today, Dr. Kim Terrell could not be with us. Maybe she won't talk about the transportation industry impeding her presence here, but she will be able to deliver her wonderful talk where she's going to discuss the challenges and strategies to understanding health impacts of industrial pollution when communities are faced with a lack of monitoring data, environmental regulators turning a blind eye. She is a research scientist with a national nonprofit environmental integrity project, and she has published several studies exposing the health burden of industrial pollution in Louisiana. Her most recent study focused on racial disparities in economic benefits from U.S. petrochemical operations, triggering political backlash, and ultimately caused her to resign in protest from her former position in academia. So today she'll enlighten us on some of her techniques in making increasing transparency and accountability.
Thank you. I'm happy to be here, even if it's not in person. Just to make sure everybody's alive and awake, I'm curious if anyone can tell me what holiday we just celebrated this week. It was a major holiday. It's why I couldn't be here.
Mardi Gras? It was
Mardi Gras, yes. So, rookie mistake, I did not allow 3 hours to get through security the day after Mardi Gras, leaving New Orleans, which is why I am here remotely. But thanks to the wonders of Zoom, we can still hopefully share some lessons learned from Louisiana. Let me just pull up my screen. Okay. Somebody yell if you don't see a title slide. Like you just heard, I'm based in New Orleans, Louisiana, and my work focuses on industrial pollution and the health effects of that. Interestingly, a lot of what we're dealing with down here is toxic emissions from fracked gas that is transported to Louisiana and used in chemical manufacturing processes. So a very different landscape from what y'all have in Pennsylvania, but a lot of common issues. And over the last decade or so that I've worked in this field, I've seen over and over again some ways that industry will misuse science to the detriment of communities. And so I think there are maybe some commonalities between the Louisiana situation and places elsewhere, including Pennsylvania. So I'll jump right in. And I know this is something that everybody's familiar with, right? How often have you heard industry say there's no evidence, of this health harm? And oftentimes it's because the research hasn't been done. Because guess what? Every time you don't have research, you're guaranteed not to have evidence. And relatedly, the other tactic that industry uses is they put the burden of proof on communities to demonstrate a health impact. And especially in places where you have small populations in rural communities, it may be impossible to scientifically demonstrate that link, right? So for example, I could survey everybody in the room right now to see if smoking causes lung cancer, and I would probably conclude that it doesn't because my sample size isn't big enough. And I like to use the tobacco industry as an example because for a very, very long time, the narrative was there's no proof that smoking causes cancer. This is a newspaper clipping from 1955. And for those of you in the back who can't see the text, it says, "Scared of smoking? ? Carry on. No proof yet that it causes cancer." And so, in public health, there's a very different approach, right? Like in public health, the burden of proof is not on the community. And instead, it's assumed that, if there's a risk, err on the side of caution. And that foundational principle is called the precautionary principle, right? So it's why when Zika virus emerged, pregnant women were advised not to travel to countries with the virus, not because the research was definitive, but because there was enough evidence there for concern. We've also in Louisiana seen over and over again poorly designed studies come out that find no significant relationship. So I really want to emphasize that in science, the default assumption is that there's no relationship. And when you undertake a study, you have a pretty high bar of statistical significance that you have to cross in order to conclude that there's evidence for a relationship between two things. And there's all kinds of ways that you can avoid detecting that relationship. So it's kind of like if you're driving up to an intersection and there's a stop sign, there's a lot of different ways you can avoid seeing that stop sign. You can be texting, you can be, distracted by a bird flying by. There's a lot of things you can do to miss that sign, but it's pretty unlikely that you're going to see one that's not there, right? And so in science, it's the same way. So for example, this study, which was published in 2010, was for a long time sort of considered, the definitive study on cancer and pollution in Louisiana. It was a case control study, which is kind of a common approach to these sorts of environmental exposures in public health. And the idea with a case control study is that you want your controls to be as similar as possible to your cases in every way except for the exposure that you're concerned about. So here, the controls and the cases should have been similar in every way except for industrial pollution exposure. However, the cases had 3 times as many smokers in that group as the controls. So when you're studying lung cancer, which has a very common cause, which is smoking cigarettes, and you're trying to find a link with a much less common cause, which is, for example, living next to an oil refinery, you need to have a more representative control group. So what effectively happened here is they said, okay, well, yeah, we saw a relationship between residential proximity to industry and lung cancer, but when we controlled for smoking, that effect went away. Well, when you control for smoking, you're throwing out a lot of the data in the study and you're looking at a much smaller sample population. And so you have less statistical power, which means less ability to detect a relationship that exists. So the last kind of way that I've seen science used against environmental justice in our state, and what I'm really going to focus on for the rest of this talk, is regulators misconstruing legitimate data. And there are some wild examples of that. The first one is from St. James Parish. So in Louisiana, we have parishes instead of counties. And this is a map that I created of every industrial facility in the 5th district of St. James Parish that is large enough that it's required to report its emissions to the state DEQ, the Department of Environmental Quality. And so the point of this slide is that there is a buttload of industry in this place already, polluting industry. And so in 2021, there was a proposal, there was an application submitted to DEQ to permit a new industrial development that would double the level of toxicity in the air in this place. So, consider that like all of these facilities together, there would be a new one that's just as toxic as everything that's already here, right? So it's a massive industrial complex that they want to build that's comprised of 13 individual plants. And it's being proposed by a company called Formosa Plastics, using methane gas feedstock, right? So again, these connections between the downstream and upstream communities. So the State Department of Environmental Quality did an absurd analysis of the potential health impacts of this development. And what they did is they said, okay, you know, a lot of people have expressed concern about the ethylene oxide emissions from this facility. And we just heard from Gary about, you know, what a potent carcinogen ethylene oxide is. So the DEQ said, well, we're going to look at census tracts in the state where there's already a facility that emits ethylene oxide, and we're going to look at the cancer rate there. And, oh, the cancer rate there isn't that different from the state average, so there's no problem with ethylene oxide. Like, this is absurd. This is not epidemiology. This is not public health. Like, this should make your blood boil and your brains explode, because it's ridiculous. So, I mean, so many problems with this. One, they didn't measure how much ethylene oxide people in these areas are exposed to, or how long these plants have been operating, or what other factors might obscure that relationship between exposure and cancer. We know that census tracts, political boundaries are not respected by pollutants, right? Like, a pollutant doesn't come up to a county line and say, oh, I'm going no further. So there's just so many problems with this approach. And of course, it's also ignoring a large body of scientific evidence from laboratory studies, from occupational studies that have demonstrated a link between ethylene oxide and breast cancer and other types of cancers. So really, I think my theme here is, you know, when somebody says there's no evidence or the data disproves that relationship, ask to see the data, right? Don't be satisfied until you are looking at the numbers that supposedly support that narrative. And so, for once in our state's history, a judge saw through these shenanigans. And so that air permit was challenged in court. A judge said, hey, DEQ, you really did not do an adequate job of considering the health impacts of this facility, particularly given that you want to put it in a place that's already burdened by over a dozen heavy industrial facilities. So DEQ had to go back and redo their analysis. And this time what they did is they said, okay, everybody's concerned about ethylene oxide and benzene. So we're going to look at patterns over time in those pollutants. And we are going to show that levels of those pollutants have decreased over time so that we can justify permitting this new plant. So how do we show that those levels have decreased over time? Well, we just have to pick the right geographic area to portray a decrease. So they focus on these three pollutants. They say, oh yeah, there's, you know, ethylene oxide has declined by 44% over time. And so what they did is they drew a 100-mile buffer around the site. And they said, we are looking, you know, at trends over time for all facilities within 100 miles that emit ethylene oxide. Again, like, this approach makes no sense from a public health perspective. Who is the person whose lungs are exposed to this 100-mile radius? I mean, this is almost half our state. And then for benzene, they took a totally different approach. They said, oh, well, for benzene, we're going to look at patterns over time in the parish. Even though the facility would be located at the western edge of the parish, even though pollutants don't respect parish lines. So again, like, this approach of cherry picking data, of being inconsistent, of doing things that don't make sense from a public health or epidemiological perspective. And then I want to, I think my last sort of example of data misuse is one that looks a little more like Pennsylvania. So this is from a rural area, maybe about an hour outside New Orleans, there is a industrial supply company called Smitty's that a few months ago had a massive explosion. And so you can see, you know, this is a pretty different landscape from the industrial corridor along the Mississippi River. This is more rural. And it's a community that's not used to dealing with environmental problems, right? So people had to be educated and organized. Because what happened was this massive explosion that obviously impacted air quality, right? And so predictably, the EPA came in and did post-disaster monitoring. And this is the map that they produced, right? So this is their air quality monitoring map. And we see lots of green circles. So if we don't question it, we might think, oh, everything's good, right? Fortunately, you know, people can see directly that everything is not good. The challenge that we often deal with in pollution exposures is that we can't see the pollution, right? Like whether it's coming from a fracking well in the ground, whether it's ethylene oxide in the air, it can be so hard to get people mobilized and educated when you can't physically see the pollution. But here was one example where people could see the problem. And, you know, when they were hearing from the EPA that there were no off-site impacts, you know, common sense obviously tells you otherwise. So how did we end up with a map of green dots? Like, how is this possible? Well, what you do is you go out with a little handheld monitor, if you're EPA, and whatever reading you get, however much particulate matter is in the air, you just set an action level higher than that highest value, right? So if we look at the legend, the little green dots mean that there was no action level exceeded at that measurement at that point in time. So, okay, well, what was the action level? If we look at the legend, you can see that it was 300 micrograms per cubic meter, right, for PM 2.5. So just keep that number 300 in mind. And like, if you dig into the data, you could see that there were several instances where levels were like in the 250 range. EPA already has an air quality index. And the 300 threshold is what is at the bottom of this screen in maroon, right? Like health warning of emergency conditions, everybody is at major risk. So what was interesting here is that there was already this color-coded scheme that existed, right? Like EPA is like, okay, green means good air quality with like very low PM 2.5 values. And in the Smitty's disaster response, they kind of abandoned that color scheme and those action levels and just created a new action level. So again, like looking to see numbers, you know, digging into the data is so critically important. And then also like asking for pictures of routine operations or disaster responses. When I look at this picture, what stands out to me is that there's an air monitor inside of a tent. And anybody who has done air monitoring knows that having unobstructed airflow all around your air monitor is very essential, right? So I don't think it even occurred to EPA that, you know, posting this would give people evidence that their response was not being properly conducted. So you know, anywhere we can find information, we always take advantage of that. And so I want to, like, in the last part of this talk, end with something a little more positive, and focus on what we do know and what we've been able to learn about environmental health in Louisiana. And I'm not going to go into a ton of details on the research studies, but I'm happy to talk more to anyone who's interested. But all the research that I have done in our state is with existing data. And if you're like, oh yeah, but my state doesn't have good data, I guarantee you it can't be worse than Louisiana, right? Like we have very little air monitoring. The places where we have monitors are places like City Park in New Orleans, where there's no industry. And so there are some data sets out there that I think are underutilized. The biggest ones are EPA data sets on pollution that are based on reported either water releases or air emissions from industry. And yes, absolutely, we have to take what we hear from industry with a grain of salt. But when we're thinking about exposures, even if we don't have a lot of confidence in the absolute numbers, we know that people who live in the most polluted areas have more exposures than people who live in the least polluted areas, even if we don't understand exactly what those levels of pollution are. So there's a lot that we can do if we can get access to health data, which I think is the bigger challenge. And so about 10 years ago in Louisiana, there was a lawsuit that forced our Department of Health to publish cancer rate data on the census tract level. Up until that time, all we had was cancer rates by parishes, right? County equivalents. And county level health data is not super useful because counties are pretty big areas. There's a lot of variation in people's exposure within an area that large. Census tracts aren't perfect, but they are a much more precise indicator of what people are exposed to. And so even though there had been like this Cancer Alley, quote, controversy in Louisiana for decades, nobody had actually looked to see if cancer rates on a census tract level were correlated with air pollution estimates. And it turns out they absolutely are. Like places in Louisiana that have higher levels of toxic air pollution have higher cancer rates above and beyond what you would expect due to poverty or other risk factors. And then, of course, we know that it's not just cancer, right? Like people, whether it's in Pennsylvania or Louisiana, there's a lot of ways that your life can be negatively impacted beyond cancer. And again, like when the burden of proof is on the community, science is always playing this catch-up game. And so we want to shift that burden of proof. So we had also looked for data on births, which is something that, there's relatively few health outcomes that are tracked in really consistent and systematic ways. Cancer is one of them, but births is another, right? Like whatever state you're in, there's data on birth weight and gestational age, right? Whether you're preterm or full term. And so similarly, once we looked at the data, and again, we're not collecting new data, we're working with data sets that already exist. We found that absolutely places where industry reports higher emissions, we see higher rates of low birth weight and preterm birth. And this concern about reproductive health and developmental health had been, part of the public conversation for a very long time in Louisiana, for decades before this study. And there is a really excellent article from the 80s that you can find online. If you Google Louisiana miscarriages pollution, and it talks about the story of this town of St. Gabriel, Louisiana, where a local pharmacist, Kay Godet, went to the media after she became concerned that her area had a really high rate of miscarriages. Like she noticed that she was prescribing medication related to miscarriage for a very large number of women compared to what she would have expected for her small town. And so this article, I think, is like useful because it it does a great job of kind of capturing the industry narrative and the antagonism that industry can have towards communities, right? So there's a quote in the article that's pretty offensive, but I share it because I think it's important, to keep this in mind. So I'll give everyone just a second to read this. So for anyone in the back who can't see, this is a quote from Fred Loy, the president of the Louisiana Chemical Association at the time. And he says, "They say the chemical plants are causing the miscarriages, but they have no proof. I could say that they bleep too much, and that's the cause of the miscarriages." So, I don't think this quote would be published today, but I think the sentiment is the same. Like, I've encountered a lot of hostility towards community members from people in industry and regulators. And at the end of the day, people are just trying to live healthy lives. So with that, I want to kind of wrap up by talking about sort of my most recent research, just briefly, because I'm starting to think not only about the harms and the distribution of harms, but also the distribution of benefits, right? So who is getting the jobs and the economic benefits from, gas extraction or gas processing, or other types of heavy industrial activity? So we know in Louisiana, we've heard over and over from the people who live next to these plants that they are not getting the jobs at these plants, or they're not getting the good jobs. And so this was the study I can't say it got me fired, but it caused me to resign last summer from Tulane Environmental Law Clinic. And it was interesting because I didn't expect it to be controversial, right? Like, I expected the cancer study to be controversial, but this is just looking at federal employment data. Literally fractions, right? Like fractions of people of color who live near these plants versus who are employed in the plants. And so we published this study. It just so happened to hit the media on a day when the president of our university went to the state capitol and was asking for money. And the governor of Louisiana was not happy about it. So there's a whole story that came after that. But I want to talk about the data because this is directly relevant to Pennsylvania. So I know this image is a lot to digest, but what you are looking at is a state-by-state analysis of how the racial demographics of the state compare to the racial demographics of petrochemical jobs in that state. So, and then like the top, the left side is, it's actually cut off, but I think the left side is chemical, the right side is oil. I might have that reversed. But the highest paying jobs are at the top of the screen and the lowest paying jobs are at the bottom. And so states that are in yellow or orange are places where the workforce is disproportionately white, right? Either the chemical manufacturing or the petroleum manufacturing workforce. And then places where it's purple is disproportionately people of color in the workforce. And, what you see is, I think, what many of us know intuitively is that people of color, even though they often live near these facilities, are not getting their fair share of the jobs. And we also looked at why that is, and there's no relationship to the racial education gap. Basically the education gap is not big enough to explain this. So I want to just wrap up by reminding all of us that we really need to shift the burden of proof, right? And it's not that there's no evidence that this is harmful. It's, hey, we know that formaldehyde causes cancer. We know that ethylene oxide causes cancer. The burden of proof is on industry to show that people are not being exposed and not getting these known health impacts. The other thing that I forgot to mention, but is super important, is the need to distinguish between reports and peer-reviewed research. Like so many times I've heard people talk about a study from industry, and it's not a study. It's a dinky little report that, you know, some industrial consultant prepared that has not been subject to peer review. And so I use the word study very carefully and very intentionally. Also, again, ask to see the data. If somebody says, oh, you know, this study says X, Y, and Z, don't take that at face value. Look for yourself, whether it's a study, a report, an emergency response. When a regulator is telling you, oh, it didn't exceed any health thresholds or action levels, ask what the value of that level is and how they justify it, and whether there's, you know, basis for it in science. Look for pictures, right? Like even if it's satellite images, we find some interesting things in Louisiana from remote sensing. And then finally, you know, think about also who is benefiting from this, because so often we are told that it's a cost benefit trade-off, but it's one population bearing the costs and another population receiving the benefits. And that's not a valid trade-off. So hope this was useful. Really appreciate y'all accommodating me on Zoom. Happy belated Mardi Gras, and thank you for your attention.
Thank you to both speakers. And I believe we have a few minutes for questions. Again, if you want to write a question on your notepads, we'll collect them and so I'll ask a real quick question that's kind of flipping the the focus a little bit, but your work with providing more transparency and more accountability, maybe it may speak to more regulation, but do you see this as also helping the industry to formulate ways to green up their industry, to make it more environmental friendly or health friendly?
I can start. I think that it would be a big tool for there to be some feedback from the people who are impacted by the chemicals to the industry. Right now, there seems to be no feedback at all because it's really hard for the communities to be aware of what chemicals. If communities saw the chemicals that they were being exposed to, and that the companies that were using them heard that feedback, I'm sure that there would be some impact in the industry. There's examples, for example, like with California's Proposition 65, by showing consumers what products have carcinogens in them, there's a big impact on the consumers buying those products, and that has a direct impact on the industry, and they actually do make a lot of changes based on that. And at this point, at least with the fracking chemicals, there's no real feedback between communities that are impacted and the industry.
Kim, I'll ask a question specifically to you. Can you shed light upon how regulators are able to use their discretion on setting action levels following emergencies? And there's concern here locally with the vinyl chloride explosions in East Palestine, but in the context also of your Smitty's example.
Yeah, so I think most Americans would be surprised to know that for a lot of chemicals, there is no legal limit on exposure, right? And so most of my work focuses on air pollution. So those are kind of the examples I draw from. But when we think about all the different chemicals that can be in the air from these operations, you know, whether it's an oil refinery, whether it's a well pad, we have federal limits for 6 common pollutants that are known as criteria pollutants. But there's a much longer list of things, including vinyl chloride, ethylene oxide, formaldehyde, benzene, for which there is no federal limit. And so some states have their own limits, but these are generally not protective. So, for example, in Louisiana, the limit for chloroprene is about 4,000 times higher than what EPA considers safe or acceptable, right? And so there's like this two things, right? Like there's a void where there's no legal limit. So a regulator can just say, oh, well, we're going to pick this action level based on some arbitrary decision. And we're going to go with that. And then, I forgot the other part of the point I was going to make. But, you know, it ultimately, like, there's no safe level of exposure to a carcinogen. You know, if you go to a doctor and you're like, hey, I only smoke a couple cigarettes a day, the doctor's not going to be like, great job, keep it up. They're going to be like, well, that's, you know, that's less risk than if you smoked more, but that's still not not a great thing to do. So, you know, I think it's important where we can find health-based standards to know what those are, right? Like first figure out what are the pollutants of concern in your area, if it's formaldehyde, if it's something else, and then look to see if there are any agencies that have recommended limits, right? So the ATSDR, the Agency for Toxic Substances and Disease Research, has like recommended limits for short-term and long-term exposure. California also has recommended limits for many chemicals. So, you know, I think bringing the conversation back to, hey, this is a known recommended health-based guideline, as opposed to this is some arbitrary action level that you pulled out of your butt on your way to this emergency response, can go a long way towards holding regulators accountable.
Yeah. I think we might have time for maybe one more really quick question, and this actually might be 2 yes or no questions, but to Gary, do you think the Colorado data gives us a clear picture of the chemicals used in fracking in Pennsylvania, or do you think that there are still chemicals unknown to us in Colorado, Pennsylvania, and elsewhere? And the second part is, are the identities of the chemicals that are masked in frac focus made known to the state regulators?
The first part of that question is, I think that what was the first part of the question?
Do you think that the Colorado data gives us a clear picture of what's in Pennsylvania and whether we know everything that's there?
Right. The problem with applying it to Pennsylvania is that many products that are used in Colorado are not used in Pennsylvania and vice versa. That there are a lot of companies that operate only in Pennsylvania, chemical companies, and so we don't know, we can't use the Colorado data to show exactly everything that's used in Pennsylvania.
And the second part was basically, do the regulators know more than we do?
In Pennsylvania, that's supposed to be the case, that for trade secrets, there's a list of chemicals that the Pennsylvania DEP keeps, and the labels that go into frac focus are used to be on that list for the Pennsylvania DEP knowing what the chemicals are. Whether or not all the trade secrets are in that, it looks like not, that there are plenty of others that don't get, aren't known by the regulators.
Thank you, and thank both of you for great talks, and that's our session.
Thank you.
Thanks, everybody.
Okay, moving right along. At this point, I would like to call up the panel for public dialogue through media. That's Reed Frazier from Allegheny Front, Quinn Glabicki from Public Source, Susan Phillips from NPR, and our moderator, Emily Copeland. So please come up and establish. I think they may be outside. I may have to go get them. They like to be behind the scenes.
They were just grabbing some water. And then where are people giving the questions that they have from the audience? Who's collecting?
Well,